This medication is commonly used to relieve mild to moderate pain such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains. It is also used to reduce fever. The recommended daily dosage for children is based on their weight and age. It is best to take this medication with food or milk to prevent stomach upset. Always follow the dosage instructions provided by your healthcare professional. When giving Kindermed Kids Pain Fever oral suspension to your child, make sure to follow the dosing instructions on the product package. It's important to use the correct dose for your child's weight, which you can find on the product package, or use their age if you don't know their weight. For liquid medication, be sure to shake the bottle well before each dose, unless the product package indicates otherwise. Use the provided dose measuring spoon or dropper to ensure the correct dose, and do not use a household spoon. If your child is taking rapidly dissolving tablets, they can chew or let it dissolve on their tongue and then swallow with or without water. For chewable tablets, make sure to chew thoroughly before swallowing. It's important not to crush or chew extended-release tablets, as this can cause all of the medication to be released at once, increasing the risk of side effects. Swallow the tablets whole. For effervescent tablets, dissolve the dose in the recommended amount of water and then drink. Pain medications work best when taken at the first signs of pain. Waiting until the symptoms worsen may reduce the effectiveness of the medication. If using this medication for fever, do not exceed 3 days of use unless directed by a doctor. For pain in adults, do not use this product for more than 10 days, and for children, no more than 5 days, unless directed by a doctor. If your child has a sore throat with high fever, headache, or nausea/vomiting, consult a doctor promptly. If your condition persists, worsens, or if you develop new symptoms, be sure to inform your doctor. And if you suspect a serious medical problem, seek medical help immediately. If you experience any unusual effects from taking Kindermed Kids Pain Fever, contact your doctor or pharmacist immediately. Most people do not experience serious side effects from this medication, as it is generally well tolerated. However, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist for guidance. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Taking an excessive amount of acetaminophen can lead to severe liver disease, and adults should not exceed 4,000 milligrams, 4 grams, in a day. For people with liver issues and children, the recommended dosage is lower. Always consult your doctor or pharmacist to determine the safe amount of acetaminophen for you. Do not combine this medication with any other drug containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is present in many over-the-counter and prescription medications, including pain/fever drugs and cough and cold products. Check the labels on all your medications to check for acetaminophen, and seek advice from your pharmacist if you are unsure. Seek immediate medical attention if you have taken too much acetaminophen, overdose, even if you feel fine. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Regular alcohol consumption, particularly when combined with acetaminophen, can harm your liver. It is best to avoid alcohol while taking this medication. Before taking Kindermed Kids Pain Fever 160 mg per 5 ml oral suspension non-opioid analgesic/antipyretic, non-salicylate, it's important to consider any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have liver disease or regularly use or abuse alcohol. If you're considering using the liquid, chewable, or dissolving/effervescent forms of this medication, be aware that they may contain sugar or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to discuss this with your doctor or pharmacist before using these products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication, as acetaminophen can pass into breast milk. Drug interactions can alter the way your medications work or raise the chance of serious side effects. It's important to keep a record of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. Some products that may interact with this drug are ketoconazole, levoketoconazole. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are taking this drug. If someone has taken too much of Kindermed Kids Pain Fever 160 mg per 5 ml oral suspension, and has serious symptoms such as passing out or trouble breathing, it's important to call for emergency help right away. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. If you or someone you know is experiencing these symptoms after taking Kindermed Kids Pain Fever, seek medical help immediately. Acetaminophen, the active ingredient in Kindermed Kids Pain Fever oral suspension, does not cause stomach and intestinal ulcers like other pain relievers such as aspirin and ibuprofen. However, it does not reduce swelling like those medications do. It is important to consult with your doctor to determine if Kindermed is the right choice for you. This medication is used to relieve pain and reduce fever in children. The dosage is based on the child's weight and age. It is usually taken every 4 to 6 hours as needed, but not more than 5 times in a 24-hour period. It is best to take this medication with food or milk to prevent stomach upset. Always follow the dosing instructions on the label. If you forget to take a dose of Kindermed Kids Pain Fever oral suspension on your regular schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember, always follow the recommended dosage and schedule for this medication. It's important to store Kindermed Kids Pain Fever 160 mg per 5 ml oral suspension non-opioid analgesic/antipyretic, non-salicylate at room temperature away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.